Great, thank you. It's great to be here in Tennessee and to be really here with the governor and his staff. We have spent the last 4 hours in discussion with his health staff, with a group of health leaders, and a group of school leaders, and with the mayor of Nashville. So it's been a really great 4 hours of really important questions and dialogue so that we could all learn from each other. Basically, I've come to Tennessee as I have from Indiana to Ohio to Kentucky because of the spread of the virus in this area. And what has really worried us is this particular wave of the COVID virus is very different than the wave that we experienced in March and April. I know Nashville and Memphis both had experiences with that wave in March and April, which was very much the major metros of Tennessee and the surrounding bedroom communities. This spread, however, is equally across the state into rural areas, peri-urban areas, small cities, and of course your major metros. And that is what has been the most concerning to us, is to watch that broad spread across the state, very similar to what they experienced across our southern United States. That part of this epidemic started as primarily new positivity and new infections in our under 35-year-old age group. Many of them were asymptomatic and spread the virus unknowingly to others. And so by the time you were seeing the virus from that small tick up in test positivity, it was well distributed throughout many of these states. So in Louisiana today, almost all of their parishes are over 10% positive. The same way across Texas, Alabama, Mississippi, Florida, and Arizona. Tennessee stands at that very important moment in time where their test positivity has just increased into the greater than 10%, with multiple counties between 5 and 10%, and several counties over 10% test positivity. And is this very moment where we can change the trajectory of the epidemic before it goes into full what we call logarithmic spread, as we've seen across the South. And so I really came to talk to the governor about how important it was for every rural Tennessean to wear a mask. It is in all of your rural counties. I know some of you find the mask uncomfortable, so do I. I put it on at 8 a.m. this morning. I haven't taken it off since. I do this out of respect for each one of you because I have been across the United States where there has been a lot of virus. And so every Tennessean today, in order to be able to get back to school, in order to ensure our businesses stay open, every Tennessean, whether you live in a rural area or urban area, needs to wear a mask to protect your family, to protect your grandmother, your grandfather, your aunts, their uncles, who we know can have very serious consequences to this disease. And so it's calling on all Tennesseans to make that sacrifice for your family, for your children, so they can go back to school, to really wear a mask and protect each other. In fact, if you have been in vacation in a hotspot area across the South, really calling on all of you to protect the elderly. Don't go and visit them for the next 2 weeks. If you have someone in your house that has comorbidities, you should wear a mask inside and protect them also. We've done a lot of modeling, and we have found that if you all wear masks, all Tennesseans, in every public area, and you protect the individuals with comorbidities, if you stop going to bars, and indeed close the bars, and limit your indoor dining, that you can have, and continue to social distance and wash your hands, that we can have as big an impact on decreasing new cases as what we had with sheltering in place. This was possible. We have our freedoms. We can go out. We can socially distance in specific restaurants and be distanced from one another and protect one another. And we can have SEC football if together we decrease the case numbers. And so Tennessee is at that inflection point. And we wanted to come here and talk to the governor and his staff and incredible Tennesseans that have led through so many other issues and the mayor of Nashville to really appeal to every Tennessean to wear a mask, particularly rural mayors. If every rural mayor could mandate mask wearing, the virus is there. You may not see it today because it may still be in young people, but it's spreading, and it will hit your nursing homes, and it will hit those that have serious consequences to this virus. We know who those individuals are. People who have trouble with weight, people who have diabetes, people who have hypertension, people who have chronic lung, renal, and heart disease. We have many Tennesseans that suffer from those issues, and it's our moment in time to protect them. And we can change the future of this virus in this state today. We continue to social distance if every mayor throughout this great state would mandate masks, close the bars, and substantially increase indoor dining distancing. Together we can get through this. So I will stop there, take questions. You know, we have had governors across the South that have issued those mandates, and I think in this case, we know that the rural mayors understand their communities the best and would know how to mandate masks specifically. We've talked to the governor about the importance of mask mandates. I think he has a sound strategy that he's working through the state. I think we're at 65 or 70% of the counties. We need 100% of the counties to have, including the rural counties, to have these mandates. Every week we issue a governor's report. This is the 5th week. They just received their governor's reports for this week. I can tell you in every red state, and Tennessee is now in the red state category. It flipped from being in the yellow state category. What does that mean? They had under 10% test positivity. They're now over 10% test positivity. And the #1 bullet is mandate mask. Close your bars. Enhance social distancing. Tell every Tennessean to not socially gather with more than 10 people, to not socially gather even with your relatives if they've been elsewhere because of the chance of spreading this virus. In many places in Texas where we were a couple of weeks ago, they talked about even outdoor events where families came together that had missed one another, socially gathered, and 60 out of 60 became COVID positive. This is the potential of how rapidly this virus spreads and how silently it spreads because of the degree of asymptomatic spread. And the way to stop that is to do everything we've talked about with contact tracing. But the way to really stop it is to have every single person in public in a mask. So each school district is going to have to look at this, and because each county is different, I think really mandating that down to the school district to do the analysis, and I know that's putting a lot of pressure on school districts. We're essentially saying that every school district has to understand public health. But we do have excellent public health individuals. I met them today, both at the state level with the health commissioner and the assistant health commissioner, but also down at the county level. If you can protect the students, the teachers, the families, and those with comorbidities, when you're in that situation where your caseload is dropping, your test positivity is falling, that is a situation that we would like to see, because what's important to us is the safety of the children, the parents, and the teachers. But let me make this also clear, and that's why it's in the CDC guidelines. The most important piece of this is to put the child at the center and to make those accommodations needed to ensure that those children have access to the health, nutrition, mental, and emotional support that they achieve in schools. And I know that's a difficult balance, and that's why each school district should be working today to decrease their caseloads. So that is my recommendation based on all the evidence we have of what it takes to get under what we call R1. And what do I mean by R1? That is so that I, infected, don't spread it to even one other person. So if it's less than 1 to 1, then you're under R1. What I can tell you is in the models, and now we have evidence from Arizona, who did just that in Phoenix. They closed the bars, they restricted indoor dining, 100% of the population in mask in all public spaces, decreased social gatherings, and even though that state was in a very difficult place with extraordinary high test positivity, they've been able to turn that around in the last 4 weeks. So it's not just theoretic any longer, it's clear. And all the other businesses, their malls were open, they had great outdoor dining, even in 110 degrees, social distanced. And so these are the accommodations we're asking businesses to make so that children can go back to school, caseloads and test positivity can drop, and all of the other business in this great state of Tennessee can continue to operate. We have put it in the guidelines as this is our recommendation at the federal level based on science and evidence of what we think will have the greatest impact on saving more Tennessean lives and decreasing the spread of this virus. I can make the recommendations of what every Tennessean should be doing today in order to ensure schools can open safely in the future. And that will be the governor and the mayors of each of these areas. I mean, we just finished with the mayor of Nashville in a great discussion and talking about how after the mask mandate and the closing of bars over the last couple of weeks, they're already seeing stability in their cases, and the potential over the next week to have a significant decline in number of cases. So I guess it's really important to really convey that we're asking everybody to make a personal sacrifice of responsibility to one another to really decrease these caseloads by doing these recommendations. I would like to believe that us saying that there's science and principle and evidence behind it, that should be good enough for every Tennessean to follow, and I know the governor feels that way and wants to, I don't think he has anything against mandating if he can't get Tennesseans through this recommendations to follow each of this so the schools can reopen safely. Recommendation to do all of those things so that schools can open safely and get these cases down. Yeah, I think that's a really good question, and I think that's why last week President Trump made it clear that he thinks people should wear masks. I think he's seen the evidence now from Missouri, and I know you all know the Missouri evidence. It's very personal to me because it was in a beauty salon. 2 actively infected beauticians who were wearing masks, and all their clients wore masks. Not a single person was infected. This is the power of what we have in our hands to change the transmission of this virus. But it does take tourist, and whether you're a Tennessean going to Myrtle Beach or Mobile or someplace in Florida, you need to take masks and do those precautions when you're out of your house. And for visitors that come to Tennessee, they need to do the same. Out of respect for every Tennessean, we've worn the mask the entire time we are here. Well, I hope if they're a Trump supporter and they live in rural Tennessee and they heard the president say last week that he thinks masks are important, and he said that several times last week in each of his briefings, that they're hearing that. And I hope the local mayors are hearing that, because this virus, and I want to be totally transparent, is spreading in rural Tennessee. And so people in rural Tennessee do not have to come to Nashville or Memphis or another large city in Tennessee to become infected. They can become infected in rural Tennessee. What concerned me during our meeting with the healthcare providers is one of the nursing home providers who has nursing homes in some of the rural areas of Tennessee was talking about the significant number of cases that are now in those nursing homes when there were none. And when there were none, it means the virus came in from somewhere, which means it came in through the community. And so we all know how vulnerable our Tennesseans are that are in nursing homes. And I hope out of respect for them and for getting our children back to school across America, that people will heed what the president has asked, the vice president has asked, your governor and mayors have asked, and hopefully the local mayors will ask.